Good day everyone, I am Shaker Balisa, BSN 2A student of Bicol University, Tabacot Campus. So for today's video, I will be demonstrating about the LEOPOLD'S maneuver for my retdem. LEOPOLD'S maneuver are systematically 4 steps in palpating the uterus to the abdomen in order for us to determine the fetal presentation and the position of the baby. It is an easy to perform, non-invasive method to determine the position, presentation, and engagement of the fetus inside the mother's uterus. This is done after 36 weeks gestation to help the expectant mother and the healthcare provider a better preparation for the labor, and it is also to help determine if it is much safer to perform cesarean section or normal delivery. Prior to the start of the procedure, I have prepared the necessary equipments to be needed. First is to introduce yourself and identify your client by getting her full name. So, good morning, ma'am. I'm Nurse Shane, your student nurse for today. May I know your name po? Okay, please state your complete name as well as your birthday, please. Okay, Ma'am Anna. So, how do you want me to call you? Okay, Ma'am Anna. So, next is to explain procedure to your client. So, ma'am, for today's, I'm going to do is to do a LEOPOLD'S maneuver for you and for us to determine the position and the light of your baby inside your uterus. Is that okay with you? So, what I'm going to do is to feel your abdomen and add a little pressure so that I can feel and determine the position of your baby. So, I'm going to touch some parts of your body. So, will that be okay with you, ma'am? Okay. Do you have any clarifications or concerns? But I will assure you that this examination or procedure will not hurt you as well as your baby, okay? Instruct the client or the patient to empty the bladder. So an empty bladder provides you comfort and makes a patient more productive during the examination. On the other hand, it is a distended bladder may obscure the fetal condition and may slightly deviate the uterus. So okay ma'am, before we begin the examination, I encourage you to void first so that later you won't feel uncomfortable, okay? Position the client in the dorsal recumbent position. So position the patient with one pillow under their head, and a flexed knee would relieve the tension of the abdominal ligature, and placing a towel beneath the patient's hip will displace the uterus off, then thus preventing supine hypertensive symptoms. So I'm back, ma'am. So are you then voiding po? So now I need you to lie down and slightly flex your knees. Provide clients privacy. So okay ma'am, I closed all the windows as well as the door to provide you privacy. 6 is to drape the client, exposing only the parts needed for the procedures, okay? So to begin with the procedure, I will only expose only the area to be examined to ensure you that we have set privacy. Then wash hands. I already washed my hands, so it's important to wash hands to avoid contaminations. Dry and warm hands by rubbing them against each other briskly before placing them on the abdomen. So this is important to prevent tension of the abdominal muscles. Okay ma'am, I will only expose the part to be examined. First maneuver is the fundal grip. So face the woman's head, place both hands flat on her upper abdomen and palpate gently to detect which part of the fetus lies in the fundus of the uterus. These maneuvers determine whether fetal head or breech is in the fundus, so proper positioning of hands ensures accurate findings. When palpating, a head feels more firm than a breech. A head is round and hard, the breech is less well defined, a head moves independently in the body, the breech moves only in conjunction with the body. The second maneuver is the umbilical grip. Palpate the sides of the abdomen to detect the location of the fetal back and fetal small parts. Hold the left hand stationary on the left side of the uterus, while the right hand palpates the opposite sides of the uterus from top to bottom. Then hold the right hand steady and repeat palpation using the left hand on the left side of the uterus. The second maneuver locates the back of the fetus. This method is most successful to determine the direction and the fetal back is facing. One hand will feel a smooth, hard, resistant surface, or the back, while on the opposite side, a number of angular nodules. This method is successful to determine the direction of the fetal back is facing. One hand will feel smooth, hard, resistant surface, or the back, while on the opposite side, a number of angular nodulations, or the knees and elbows of the fetus, will be felt. For the third maneuver is the Umbilical Grip. So palpate the lower abdomen by gently grasping the area just above the symphysis pubis between the thumb and the index finger, and try to press the thumb and fingers together. Determine any movements, whether the part is firm or soft, to detect what occupies the pelvic inlet and whether or not it is engaged. So for the third maneuver, this determines the part of the fetus at the inlet and its mobility. If the presenting parts move upward, so an examiner's hand can be pressed together, the pressing part is not engaged or not firmly settled into the pelvis. So if the part is firm, it is the head. For the fourth maneuver, it is the pelvic grip. So facing the foot part of the client, palpate the abdomen by placing fingers on both sides of the lower abdomen, approximately 2 inches above the inguinal ligaments, and press downwards and inwards in the direction of the birth canal. Allow fingers to be carried downward to detect head's degree of flexions, position, and even station. Fourth maneuver determines fetal attitude and degree of fetal extensions into the pelvis. It should be done only if the fetus is in a cephalic presentation. Information about the infant's antero-posterior position may also be gained from this final maneuver or final stage or positioning. Okay, so we are done with the examinations or the procedure. So I will cover your abdomen, pull down the gown. Then inform the client of the result of the examination. So okay ma'am, I have determined that your baby is at your right side and that the baby is in a cephalic position. So the head of your baby is on the lower part of your uterus and it is already engaged. So this is a good thing because this is an ideal position of a baby. After the procedures, we have to perform hand washing. So I'm already done doing hand washing. So pull down the gown to cover the abdomen. Then we should document the findings.